want to be recorded, please keep your camera off. Thank you so much for joining. Today's webinar is on a preview of the American message to anticipatory action. So I'm very excited to have you all in attendance today. Today's presenters will be Tiara Humans, who's the Division Disaster Director, and Erica Karapandi, who was the former Disaster Program Manager with Mass Care and Logistics, who helped to support the review of the American Red Cross's approach to anticipatory action. So I'm going to pass it over to Lisa real quick for a few comments, and then we'll get straight into the presentation. Over to you, Lisa.
Thank you, Rita. Yeah, I'll be real quick. Greetings from Geneva. It's wonderful to see so many familiar faces on here. I will do a quick intro for those of you that don't know me. My name is Lisa Williams. I manage our cash and anticipation work in the International Services Department of the American Red Cross. As Rita mentioned, I'm here to introduce all the exciting work of Tiara and Erica looking at the domestic anticipatory action approach. This was quite the undertaking because, as many of you have heard me say in other spaces, the way that domestic American Red Cross approaches anticipatory action is much different than how we've conceptualized it in the international humanitarian space. A lot of the language, the paradigms around it domestically are kind of woven within some preparedness, readiness, response mobilization, response. So kind of lifting out from all these different areas what would apply to anticipation and international was a lot of work. And also, given that we have different language and how we describe things and conceptualize things, it took quite a bit of digging. So really appreciate all of the tireless work from Tiara and Erica on this. But it really was such a worthwhile endeavor. We were able to learn so much about what American Red Cross does in this space and really show how anticipation can be done differently. Their approach is much more dynamic. It's not hazard specific. It's not scenario specific. They have created approaches and tools that allow them to be dynamic, engage in real-time planning, and really leverage expert decision making to release resources based on a forecast and then adjust those decisions in real time as information changes. So we are sharing this in several forums just to get other practitioners thinking about other ways to approach this work. And without further ado, I will hand it over to Tiara and Erica to share more of what they've learned, and then we can turn it over to a Q&A to kind of dig into any questions people have. Thanks.
Perfect. And to start our presentation, we're going to just show the 5-minute video explaining the entire process, and then Erica and Tiara will go into more of the explanation and highlighting details. So bear with me for one moment as I share. Oops, I'm so sorry. I just realized I didn't click the right button for sharing. Second. Try again.
The American Red Cross's domestic anticipatory action approach aims to mitigate disaster impacts before they fully materialize through 3 interconnected pillars: operational readiness, forecasting and planning, and dynamic financing. The first pillar of operational readiness establishes a foundation for action in the anticipation window and effective early response inside the organization. We use national readiness targets, which are set every year based on estimated service delivery needs per geographic region. Benchmarks are set for how many trained personnel will be needed, maintenance for infrastructure, disaster response supplies necessary to have on hand, and community relationships through updated agreements with disaster response partners. The targets help each geographic area assess their capacity to respond locally to a disaster until more support can be provided from the national organization. we use local to national training and recruitment regimens to build the capacity of our personnel. Geographic regions have specialized staff, both paid employee and volunteer, to manage volunteer recruitment, onboarding, training, deployment, and post-deployment support. Regions have annual goals around volunteer recruitment and training to help build their local disaster response capacity. Importantly, we consistently maintain our data management system, AmRC Care. AmRC Care is integrated with financial service providers so that beneficiaries can elect to receive their assistance immediately in the way that suits them best. We run a supportive communities readiness program that formalizes planning with our partners in local government. This helps to anticipate resource requirements and identify constraints ahead of a disaster response. And finally, we have a national support plan that guarantees our teams can sustainably escalate a local operation into a national one should the scope or scale of the disaster increase. The national organization is responsible for providing resources on scene within an agreed timescale, utilizing strategic supplies in warehouse hubs, and recruiting personnel from across the country when needed. The second pillar of our approach to anticipatory action is forecasting and planning. We strive to predict disaster impacts through prediction models that look at a hurricane's landfall probability using historical data and population vulnerability maps. These models, developed and used by a national planning team, help to determine the potential scale of the disaster response, and therefore the timeline of actions to take ahead of landfall. For example, a hurricane with predicted large-scale damage will require more personnel to move on site earlier to meet service delivery needs. We have standard mass care planning assumptions for staff and resources we will require based on the predicted impact on the population. Depending on the forecast, emergency shelter sites may be put on standby with pre-positioned supplies so that service delivery can begin as soon as evacuees arrive. We rely on expert decision-making from trained senior leadership and a notification process from the field to inform when to activate each mechanism in our response structure. Decision-making to initiate a disaster response can be either top-down based on date or ground-up rooted in small-scale disasters that begin to increase in intensity. Finally, our third pillar, dynamic financing, enables us to fund anticipatory action successfully. We built a finance structure that includes a 7-level classification system of how much an operation is projected to cost. This allows us to structure our annual plans based on how many disasters we expect, large and small, and then budget accordingly for the year. We want to make sure funding is not a barrier to action when a forecast arises. We also conduct pre-impact resource allocation so that supplies are prepositioned ahead of impact. Based on our mass care planning assumptions, the organization can move resources like shelter support trailers to where they will be needed most. And finally, we make sure that we can flexibly assign responders to an operation even before there are account codes to charge them to. Responders are put on standby through an internal assignment system, which allows them to be quickly activated and deployed as soon as the disaster response financial account is open. This 3-pillar approach transforms our traditional response to disaster by prioritizing readiness, planning, and flexible financing to reduce reaction times and optimize resources. Through systematic analysis and coordinated decision-making, the American Red Cross demonstrates its commitment to anticipatory action to ensure we complete our mission and mitigate the negative impacts of disaster.
Okay. All right, you want to take it away?
Sure. Thanks so much. So playing off of some of the themes that we saw in the video, Tiara and I will go into a bit more detail. So this presentation takes a look at anticipatory action in the context of American Red Cross's domestic disaster relief branch. And as Lisa mentioned, we don't use the term anticipatory action in our domestic work. So we undertook research to see how some of those main components of anticipatory action are applied. Tiara and I are both members of the domestic American Red Cross team who also volunteer with the international services team. And so we wanted to look at how domestic American Red Cross initiates those large disaster responses through an anticipatory lens. American Red Cross is a large, complex organization with a really wide geographic coverage over a wide variety of hazards. And so we were interested in the steps taken in that anticipatory space that allow for speedy disaster response. Disaster Cycle Services is what we call the domestic branch focused on disaster relief. And so our research was aimed to capture how DCS employs expert decision-making and uses dynamic planning tools to carry out anticipatory action. And Tiara and my research was mostly done through key informant interviews with DCS employees and volunteers across the organization. The next slide, please, Rita. So this is a general overview of anticipatory action that we use to inform our research. I think since this is an audience that is familiar with anticipatory action, we just wanted to put this here to just show you that this is what we used as the basis. And then into the next slide, Rita. We took those 3 buckets of anticipatory action, those 3 main concepts of seasonal preparedness, anticipatory action, and response, to break down the actions taken by DCS. So under seasonal preparedness, we have some of those readiness activities, reviews of prediction models, predictions of operational costs. And those are all actions that take place that inform the early actions that then occur in that anticipatory window. Once a disaster strikes, then we have landfall, then we move into the traditional disaster response operation. Next slide, please. So from the domestic point of view, we rely on expert decision makers, both at the national headquarters level as well as at local levels. Funds are available for disaster responses across the organization, so we don't have to wait for fundraising against a specific disaster. So we're not waiting for landfall and then fundraising against that to start an operation. It's more like DREF funding, where we do have a pool of money that's available for disaster responses. We also have tools that are used across the organization and agreed protocols so that disaster responses are able to escalate in a predictable and an organized way. We wanted to also note here that American Red Cross does not do pre-impact distributions to the community, but our strengths are really in this robust and annually reviewed readiness process and fast-efficient shelter setup and service delivery. Next slide, please, Rita. We wanted to include in this map just to really emphasize how large the organization really is. In this presentation, Tiara and I will refer to the national organization, which oversees DCS, Disaster Cycle Services, across the whole country. And we'll also talk about regions, which are the different colored areas on the map, which are smaller segments of the country, so more localized segments. So when we have a disaster response, both the national team and the regional teams need to work together, but they also have specific responsibilities when a disaster is incoming. Next slide. Okay, so the core components of anticipatory action in DCS, we have in this table on the left side are the terms that are used by the Red Cross, Red Crescent movement in anticipatory action. And then our translation, what we found as specific programs or aspects of American Red Cross's DCS are listed there on the left side. And so the rest of the presentation will go into more specific detail about each of these bullet points. This is kind of the outline of what Tiara and I will cover. So starting off with National Society Preparedness, I will turn over to Tiara to go into more detail. And that's the next slide.
All right. Yeah, so as Erica said, with our National Society Preparedness, what we're really looking at here is domestically our operational readiness and our seasonal readiness, because these readiness actions really are the base for our early actions. So looking at national readiness targets, so you saw that map that Erica put up with all the colorful regions. We have over 50 regions across the United States. And each of these regions do have internal targets around readiness that are based on the estimated service delivery needs for that year. And it's looking at that specific region's risk, et cetera. These readiness targets are there to ensure that our regions are able to sustain the capacity and capability to accomplish the American Red Cross mission in coordination with our partners. Some of these readiness things that we do, the actions that we do include things like having the availability of trained people. So that's really looking at our personnel capacity building. It's having accessible infrastructure, program, and systems to ensure that we can quickly provide assistance to the impacted communities. Having the availability of necessary supplies, and that includes things like vehicles. And then the relationships of a supportive community. So again, those partnerships are really key in ensuring that we can do accurate service delivery. These readiness targets not only help to ensure that our regions can respond to the local events and disasters that take place day in and day out, but also as things scale, they're there to ensure that the regions can cover the first 72 hours of a scaling a larger event. So those first 3 days, we want to make sure that the region can cover with local staff and stuff until reinforcements do then arrive in. We know that the disasters are going to start at that local level. So really, in a nutshell, these readiness targets are ensuring that we have those right resources in the right place at the right time. Next slide, Rita. So looking at a couple of these aspects a little bit more in depth, so personnel capacity building, so having those trained people available. The American Red Cross, again, we rely on having trained responders to address those immediate needs that are going to be caused by a disaster. So we recruit and we train volunteers ahead of disasters. And we're also continuously working on building our capacity by establishing leaders, supervisors, managers who can help as we escalate events. Again, this starts at that local level with that local team and local recruitment, trying to find the right folks for the right positions. It helps us also to understand our capacity as for initial staffing, and then also identify gaps that we may have. When a disaster does strike, then depending on the size and scope of that disaster, as it scales up, we will then start pulling in those national resources. Some of those initial key personnel and trained people that we're going to be looking at are shelter workers and disaster health services workers, because emergency sheltering is one of the key and initial things that we are going to do in a disaster. Next slide. Okay, and then talking about supportive communities, again, emphasizing how key those partnerships are to us delivering our mission. We are one of multiple agencies and organizations that are going to respond, and it's really important that we understand how we can all interact together and help one another to assist the community. So that supportive community process that we have, it's our yearly, it's really a seasonal touch point that we have with our government partners. This is for us to assess our capacity, but we also are going to commit to a level of service delivery. So again, to understand what our partners can do as well and put a plan in place. Sometimes this might be a more formal, well, we are written into our partners' plans. And then also maybe more informal conversations that we're having where we're really setting those expectations. So again, it's really around expectation setting, fulfilling our commitments. One of the key expectations that's important to set is around sheltering, again, because that is one of the key components that we are going to be doing in conjunction with our emergency management agencies that we work with on the ground. We also tend to look a lot at the high probability and high consequence events, right? So again, of all the various different regions we have across the country, the high probability events are going to look different, right? In some areas, wildfires are going to be those high probability, high consequence events, whereas other parts of the country, we're going to have hurricanes or flooding, winter storms. So again, we're looking at that. And then, of course, once a disaster does hit, we will continue to assess the need and keep that regular communication with our partners. So while we're setting these expectations ahead of time, we know there's going to be nuance to every disaster that takes place, and having that regular ongoing communication allows us to pivot and be flexible as additional needs do arise. Next slide, Rita. And then finally, just another thing that we have in place is our national support plan. And really what this is to establish and enable, sustainable escalation when we do have a growing operation across the United States to make sure that we can meet the scale of the need that does arise. So again, this plan does look at not only the needs for people and things. So again, we may need more materials, may need more people, and there are certain packages that we may push out of certain trained individuals or supplies that do get pushed out when we know that an operation is going to grow to a certain level. But this plan also provides some standardization around the reception of those people and supplies, the staging, and then of course the onward movement and integration into the operation. Again, we know that things are going to scale up from the local level, and we need to be able to efficiently integrate the influx of people and supplies that are going to come in as that does scale up. So again, this national support plan tends to be executed for more high-level operations as they're scaling up. And again, in these situations, it's incredibly important to understand and to know who needs to do what in that situation. Next slide, and back to you, Erica.
Okay, so next we'll delve into how forecasting helps American Red Cross better understand incoming hazards. So American Red Cross uses data, both internal historical data on disaster responses, as well as data from partners to make predictions about what early actions we need to take. So for prediction models for hurricanes specifically, DCS uses prediction models based on historical weather data to predict the likelihood of hurricane landfall in the United States. So the prediction models are taking that historical weather information about where hurricanes form in the ocean and the likelihood then of making landfall. That information is crossed with information about coastal population centers. And from there, DCS has built 21, we said 21 plus because this is a growing portfolio of response scenarios to predict the level of impact of an incoming hurricane on the seaboard population. So once we have a response scenario, we're able to, based on level of intensity and population, we're able to build our service delivery plan. And that's the next slide, please. So the mass care planning assumptions is the tool that we use to build out service delivery planning. It's an internal tool that's based on historical data from American Red Cross disaster responses and also includes information from the US Census on population level. So the tool takes that information and then also looks at predicted intensity level, and that helps us understand the size of the impacted population. And once we have the size of the impacted population, we can begin to estimate our staffing and our resourcing needs for the response. The next slide, please, Rita. This next slide shows some of the intensity criteria that are used in that mass care planning assumptions tool. So you can see that we're looking at just a general 3 buckets of high, medium, and low, but we do have some criteria in what we consider high, medium, and low intensity across different hazard types, because again, the United States does have diverse hazard risk across the country. And so, we do have this tool that is adaptable beyond just hurricanes. Then next slide, please. And we also look at expert decision making, and that comes from both the national organization level as well as the local level, the regional level. So at a national level, we have experts in what we call the Situation Assessment and Decision Support Unit, who work closely with leadership as well as with national partners, for example, national weather partners, to track incoming hazards and begin to make decisions about when we need to begin activating. At a local level, though, regions will also notify and update the national headquarters when there are no notice events. So something that like a wildfire that is hard to predict ahead of time, or small scale disasters that begin to balloon up and escalate. So either top down or bottom up decision making can initiate an operation. Then next slide, please, moves into financing and back to Tiara.
All right. So yeah, as Erica mentioned earlier, and as you kind of saw in the video, that the financing for the American Red Cross can bridge between ongoing readiness to specific financing for a particular hazard or disaster. So looking at projected operational costs. So our disaster cycle services uses financial levels to categorize responses. And those levels that we use help to set our planning assumptions for a fiscal year. So again, we use levels, it's between 1 and 7. And that can range. We first start escalating when we hit about $10,000 US. And then when you get to a level 7, we're looking at disasters that are costing over 10 million US, right? And so all the levels in between kind of bridge our way up to the level 7. An example of, kind of that planning assumptions that we may put in place around these levels a couple of years back in fiscal year 2024, we used a planning assumption that our organization would respond to 3 level 7s. So again, that's the highest level we have, the 10 million plus disasters. So at least 3 of those in the fiscal year, and about, at least 30 level 4s and above. And level 4 starts around $250,000 US. So, and that includes anything above a level 4. So those planning assumptions are used, and the American Red Cross, we fundraise against those projected overall costs. And then we also will fundraise for specific hazards disasters throughout the year that take place. This sort of model does give us flexibility to move early to support operations. Next slide. And once there is a reliable forecast of an incoming hazard, we can go ahead and establish that disaster relief operation, which then does open that DRO specific funding, and an account string is created to be used. So that DRO financing can then be used they can be used before the disaster strikes as well, for pre-impact, where we do things such as pre-position our supplies. We may move things like shelter, support trailers, and then of course we can start assigning personnel. We can start flying folks out and start really setting that operation even before that disaster strikes. Slide. Back to you.
All right, so now that we have our forecast, we can move into the early actions that are taken in that anticipatory window between the forecast and the landfall. And then next slide, please, Rita. So we wanted to first talk about a tool that is available to the public, the American Red Cross Emergency app. So this is an app that can be used by individuals to take their own early actions, and it's a free early warning app available to the public. It provides information about different hazards, and it echoes emergency alerts that go to the local area set by the users. So a user can set the alerts for where they live. A nice thing about this particular app is you can also set it for other areas. So if you're planning to travel to an area, or if you have loved ones in another area, you can also get the emergency alerts for those areas. It provides information about what to do in different types of disasters, so many trainings and to-do lists and guidance. And if a disaster is incoming, it also provides a live map of where there are open shelters and Red Cross services available. The next slide, please, Rita. The Community Adaptation Program is another program of the American Red Cross. It's really a disaster risk reduction program developed at developing community level response capacity. So the approach that CAP takes is to work directly with community members to identify barriers to recovery, and then work backwards from there to figure out interventions. So it's a DRR program that intersects with disaster response, but it is a separate program. It's a separate budget line. So if CAP comes up with an early action intervention, it's not part of that overall disaster response financing. An example of how CAP can have a potential project that is part of early action is an example from Louisiana. In that scenario, the CAP team was working with a medical clinic that identified a barrier for young families to evacuate. They needed feeding supplies so that they were able to leave their homes and evacuate safely. The clinic proposed using CAP funding to build feeding kits to distribute to families with young babies so that they could evacuate with those supplies on hand to continue feeding while away from home. So this is a way that the CAP program can intersect with the disaster response space. Next slide, please. The mass care planning assumptions tool is continued to be used throughout the space before a disaster and into the disaster. So once we have a specific incoming hazard, we have that forecast, we continue to use the same mass care planning assumption tool, but we're able to refine it to better understand the impacted population size and to really refine down the staffing and resourcing needs that we need for that specific response. These more specific numbers drive our resourcing of personnel and supplies and our sheltering requirements for the response. The next slide, please, Rita. Pre-assigning personnel. This is an internal tool used by the American Red Cross to begin to move quickly. So when there is a forecast, we do sometimes assign personnel once the DR string has opened, accounting string has opened, and we can start flying personnel out if they're needed. However, we've also built what we call a standby disaster response operation to act almost as a holding pen for disaster responders before the official disaster response is open. So before there's an accounting string to begin moving people around. The reason why the American Red Cross chose to do this was because it allows us to take all of the administrative steps to assign a disaster responder to the operation ahead of time. And this has really cut down the response time for moving disaster responders on site from 3 days down to 1 day. So it allows the organization to move more quickly, and it also helps the organization have a better gauge of the personnel capacity available. So we know that once a disaster responder is assigned to this holding pen, they're committed to go within a day once a hazard strikes. So it helps the organization move more quickly and more predictably once we have landfall. The next slide, please, Rita. For last mile supply prepositioning, once we have known information about the hazard, we have that specific forecast, we understand the size of the impacted population, we can begin deploying supplies from the national warehouses. The American Red Cross does have national warehouses across the country, and the supplies there are meant to supplement those supplies that are held in the regions that are part of the national readiness targets that Tiara talked about. So when we're anticipating a large scale disaster response, we can begin moving these supplemental materials. So things like 800-person shelter support kits, the electronic equipment needed to set up a large disaster response headquarters. So these are really supplies that are meant for a disaster response that is going to be larger than what would be expected to be handled just within the local team at the region. The next slide, please. And when a hazard is incoming, we may put emergency shelter sites on standby. So meaning that the facility owners agree that this will be a shelter site, and we can move supplies on site to quickly open if needed. And we may also open evacuation shelters to provide a safe place for folks to stay before landfall. Service delivery for American Red Cross begins as soon as we open a shelter and have clients coming in. So we begin disaster feeding and disaster health services. So even if it's an evacuation shelter and we have not yet had landfall, we do begin service delivery as soon as there are clients. And then the next slide, once there is hazard impact, once the disaster strikes, we move into the more traditional disaster response operation, and then we're out of the anticipatory space. So at this point, any of those early actions taken are absorbed into the larger disaster response. So the actions that American Red Cross is able to take in those preparedness and anticipatory windows allow the organization to really respond quickly and dynamically to disasters across a large geographic area and really a diverse set of hazard risks. So although the American Red Cross is a large organization, it's able to respond quickly thanks to these robust readiness standards, these clearly outlined plans and tools, and the financial flexibility to activate as early as possible. The next and final slide, Rita, we wanted to give some time and space to the group to give you time to ask questions, provide your feedback. Tiara and I joined this project as researchers, and so we're also really interested in what would you like to learn more about? Like, where can we take our next step in this research project? So I can turn back, I think, to Rita or to Lisa to open up for questions and see if anything has come through chat.
Perfect. Yeah, so feel free to utilize the chat function or raise your hand if you have any specific questions related to the presentation or the process that American Red Cross takes.
Yeah, we are also happy to revisit any of the topics we covered. I know that I speak really quickly when I'm a little bit nervous in presenting, so please do ask us if there's anything that we went over that wasn't clear, if you want to backtrack and go back and see any of the slides again. We were moving pretty quickly.
Okay, we have our first question. Go ahead.
Good evening or good morning, wherever you are. I'm from Norwegian Red Cross, and thank you for a very, very interesting session. I was really enjoying it. I just have one question, just for my own clarification, and it goes on the app that you have. So all of the alerts and the incoming, the AmRC app, I guess, is it who are reporting in on those alerts? Is it coming from the communities, or is it coming from, for example, the Meteorological Institute? Who is providing these alerts? Thank you.
Tiara, I will need you to correct me, but the app is really taking the local weather alerts that are coming out through the government and pushing them out through the app for those specific geographic areas. So the nice thing is that you can set the alert. So, you know, for example, like I live in California, my family's in Pennsylvania, and I can set the alert through the Red Cross app to get Pennsylvania information, which if I'm not living there, it's harder for me to get those general government alerts. They're not automatically pushed out to me since I'm not a resident there.
Yeah, that's correct. Yeah,
Thanks, Tiara.
The information, yes, again from our government partners, and then we do post our shelter location or service delivery sites, but the rest comes from exactly the National Weather Service.
But then the American Red Cross also has complementary actionable guidance related to the hazard too. So once an issue is alerted, or an alert is distributed by a Met agency from the government issuing these warnings, then actionable guidance will follow that. So American Red Cross would never just push guidance without an alert also being put out beforehand.
Okay, thank you very much. So then I understood you correctly. If it's not coming from, for example, the volunteers living in that area, but it's rather from the partners that you have from a governmental side.
Correct.
Thank you.
Any other questions? Yeah, Mohammed.
Hi, thank you, Rita, Erica, and Tiara for the presentation. Just my question is around one of those nuances that's the difference between, I guess, domestically and internationally. When it comes to like your clients and registrations and how like the criteria, is there anything around that, or is it like open to the public and as long as they're within the disaster affected areas, or is there anything around how people are registered or how you verify them and all of that? Or how they are, that's how American Red Cross domestically does it.
Yeah, domestically, American Red Cross shelters are, we use the phrase everyone is welcome with our shelters. They are intended to help people who are impacted by the disaster. So, so the shelter sites are put out through our app as well as through maps that are shared by our partners and emergency information that's put out to the community. They will say there is an American Red Cross shelter open at this space, and anyone who comes in who says they are affected by the disaster is welcome to stay at that shelter. There are some nuances around people who are, for example, required by the police to register, but in general, we say that everyone is welcome, and we will find a way to shelter anyone who comes and is disaster affected.
Thank you so much.
We have a question in the chat from Jose Bonilla. He says, do you have any specific accountability process to measure the services provided? Examples, working with the community through the community adaptation program, sheltering, relief, etc.
I'll at least start, and Erica, feel free to jump in. But I will say, with our community adaptation program, we do have a lot of set standards around the agreements that we make with partners in that space, and it's both in the the DRR world, but also there's a role in disasters. So when we partner with a local organization, we may find a gap. The community adaptation program focuses on three areas. It's housing, health, and hunger. And those are the three categories they use. And if we identify a gap, like say there's an organization that usually is able to distribute food, but they need a vehicle to do that. They don't have a vehicle. It's just an example. There's many different CAP programs. We may help them to fund that vehicle and work with them on getting that vehicle in place. But then we do track as disasters take place, and these programs are set in locations that do have high risk for specific disasters. When we do set up our operations, those partners then do have a role in the operation as well, and we do all track that, and we do reassess those over time. And there are some partnerships that we've started and said, okay, we're not going to continue this, and we do adjust over time. So that's around CAP. There's a lot in place that we do track and measure on that piece. The shelter, I think Erica kind of talked about how that really is that kind of everyone's welcome, that we just set those up in a potentially impacted area. And then around relief as well, we do have standardizations around how we provide supplies, and that may be our mass care supplies, which is things like blankets and comfort items, to then financial assistance. And we do have some set standards around that, and some quite vigorous processes in place around compliance and monitoring to ensure that, again, we're crossing our T's and dotting our I's and making sure everything's in place there. So I don't know, Erica, if you have anything to add on that piece.
Yeah, there are particularly shelter population counts are very closely tracked by the organization. That's one of the ways that at a high level, our organizational leadership are able to see what is our current disaster response sort of scope across the country. And from disaster shelter populations, we're able to figure out what other resourcing we need. If, Jose, you meant more about like, how do we figure out like our measurements? I think Tiara talked quite a bit about the accountability part, but feel free to go back in the chat if we've not answered your question completely.
Thank you both. We have another question in the chat from Jafar Iqbal. What are the other major activities being taken as early action, aka during the lead time?
Yeah, so I think those early actions that we went through, really moving the resources, so our personnel and our supplies on site, and opening shelters, are really the main early actions that American Red Cross takes ahead of landfall. We did want to go into quite a bit of the readiness that we go through, just because not all of the disasters that we have hazard risk for in the United States are ones that we're able to predict ahead of time. And so a lot of those readiness actions that we take are really important for no notice events, or events that are just harder to put on a timeline. So things like wildfire and tornado.
Yeah, and I'll just add to this quickly. I do think some of the actions that we see for heat waves and cold waves in the international space that are considered anticipatory action, like opening up heating centers, cooling centers, American Red Cross may do that, but would maybe consider it more along the lines of response. But I think there's some alignment there. But yeah, I mean, this gets at an interesting area. I think there's so much to learn about all of the infrastructure and process and approach that American Red Cross domestically has to enable acting quickly. But when it comes to actually a lot of service delivery, delivering cash based on a forecast, that has not yet happened. And so I think it's actually a really complementary space to kind of, domestic has these approaches to share, and then international, I think there's a lot we can pull to kind of encourage American Red Cross to maybe thinking about extending more of their intervention itself into that lead time window. And I think there have been some pilots around, funding gas cards to help fund evacuations, some feeding packages, things of that nature, but nothing large scale yet. But I do think the momentum in the international space could maybe shift that over time. Thanks.
Colin, go ahead.
Hi there. Thank you very much for the presentation. It's really interesting to see how much this topic has evolved over time. And specifically, I'm referencing perhaps my previous era in domestic, where a similar initiative, perhaps not as progressive, which was referred to as the CEDRA, Chapter Disaster Readiness Assessment. And I'm curious to know, in this new world of anticipatory action, are we either domestically or internationally planning to budget for exercising or any type of tabletop, not internally with our own stakeholders and business units, but more in terms of exercising with other stakeholders that are outside of our organization? Thank you.
I can I can actually address that. So before I joined the Global Disaster Preparedness Center, I was a disaster program manager in San Francisco for 3 years, and that was part of our regular readiness activities built into the core components of disaster cycle services. Is regular communication with government partners, non-government organizations as well, nonprofits, local CBOs in the area as well, to coordinate, exactly that, simulations, tabletop exercises on a wide variety of localized hazard risks. So yes, I think this is like a very core and integral part of domestic approach in making sure we're connected and working together with community stakeholders.
Yeah, one thing, I can't speak to the international part of the question, but just to build off what Rita said, I think that especially in, Colin, kind of as you mentioned, as things progress and as we, one of the big things are, we're looking at anticipatory action space here, but one of the other things that the American Red Cross is looking at a lot is just the state of continuous response that we're in, right? Like, there's less time in between disasters, and especially these large, billion-dollar disasters. And as part of that, we have seen actually especially around those readiness targets that we talked about. One of the things that, didn't really talk about here because it's quite recent to what we're doing, but, we are building actually some specific drills in place, like Thunderbolt drills, where we can like quickly assess our capacity to scale up very quickly. And that's both, for our teams with the American Red Cross, but also with our partners, because a lot of times we're working with our emergency management partners to help us locate, say, facilities that we may use for sheltering. So that's something that we're really actually formalizing a bit more into some of these readiness actions that we're taking moving forward. And that actually, we started really formalizing that this fiscal year, fiscal year of 2026 that we're in now. So.
Thank you both for those insights. Appreciate it.
Any more questions? All right. Well, if there are no more questions, or if you think of any questions afterwards, feel free to send me an email. I'll be happy to get those questions answered for you. But much appreciated, everyone, for your attention and your attendance today. Like I said, this is recorded, so I'll be able to share out the recording after after this presentation. So thank you very much again, and I'm going to pass it over to Lisa for any final comments.
Just a huge, massive thank you to Tiara and Erica. This really was, as I mentioned, such an undertaking and has been so helpful in taking us from, oh, there's stuff over there and we really want to talk about it, to having, as you can see, really concrete things to share. If there are any, like as Erica mentioned, if there's other areas that you really see value in them looking into further, we would love to hear your feedback. And we hope to continue sharing this in other spaces as well, especially more of an international audience that can also take their perspective. So thank you so much, everyone. I really appreciate the time.
Wonderful.
Thanks,
Thank you all.
Great to see some familiar faces.
Thank you.